Greetings, I'm Jeff Carter with Seattle CityClub. I go by he, him. Welcome to this virtual Civic bootcamp program on anti-racism strategies for health equity. Just so you know, Seattle CityClub is a small nonprofit with a big mission to strengthen our community through conversations on critical issues like this one and encourage civic engagement. So with that, I'd like to welcome our moderator, Enrique Cerna, Senior Correspondent with Crosscut and KCTS 9. Who will kick off the conversation. Welcome, Enrique.
Thank you very much, Jeff. I appreciate it. I want to note that I'm a retired senior correspondent with KCTS 9, although I still have an association with them various times doing things, but still my home base in many ways. Very pleased to be with you today to be part of this conversation. And I'd like now to introduce, actually, I'm going to have our participants introduce themselves and tell a little bit about the work that they do. And let me start with Wendy. Wendy, can you weigh in and tell us who you are?
Thank you so much. It's a pleasure to be here. I'm Wendy Barrington. I use she, her pronouns, and I'm an associate professor at the University of Washington Schools of Nursing and Public Health at the Seattle campus. And I've recently stepped in as inaugural director for the Center for Anti-Racism and Community Health within the School of Public Health. And so that describes kind of like what my titles are, but really what I seek to do as a part of my professional and personal kind of being is to partner with communities to reduce health disparities, to promote equity, and to try and do that in partnership, really leveraging the strengths and assets and priorities of communities of color in order for those communities to achieve maximum health and well-being. So thank you. It's wonderful to be here.
All right. I'm going to turn to Barry.
Thank you. Thank you. Thank you for having me. And thank you, everyone, for coming to listen to us have this major discussion. My name is Barry Robinson. I'm the Executive Dean of Healthcare and Human Services at Seattle Central. I am a researcher by heart and then kind of transitioned over into the educational field. And during both my research and my current, let's say, rise throughout the educational process, I love getting out and sharing my knowledge with the community and trying to address some of the issues that the communities are concerned about. For when in research, I was talking about HIV and how it spreads and knocking down some of the myths and providing, we'll say, information on that. Here in the educational system, I'm basically trying to re-innovate some of the knowledge and stuff that surrounds healthcare programs and trying to get individuals such as people of color more involved in the healthcare field versus being, we'll say, a victim of the healthcare fields. So looking forward to having those discussions, and thank you for having me again.
Mariel.
Thank you so much, Enrique. And I have to say it's a pleasure and an honor to be with all of you this morning, but especially to share this virtual stage with you, Wendy and Barry. I'm really looking forward to the conversation that we all are going to have. I'm Mariel Torres-Mehdipour, she, her, they are my pronouns. I have brown hair, brown eyes, and a charcoal colored top that you might not be able to see very well because of my blurry background, and a turquoise beaded necklace. I'm Deputy Equity Officer with the Public Health Department for Seattle and King County, and I'm with our Office of Equity and Community Partnership. I've also been serving as the equity officer for our COVID-19 response since late February of 2020. And that's, a little bit, I guess, of my titles and my quote unquote day job. But I have over 20 years of experience in working within public health. I did my academic preparation, have a master's in public health. But what I do have to say is that even though my academic preparation was around what it meant to work with community, really the work that I do is not work, it's a labor of love because of who my family, basically of where I come from. I'm the proud daughter of Mexican immigrants. My dad was undocumented, and seeing the struggle that they and many members of my family and neighbors had, plus my own lived experience going through the academic institutions and then, post-grad life and work, really informs exactly what I do and how I try to build relationship in the work, because my work has been very closely tied in working with community, not at, but with and to co-create with them. And so that's really the perspective that I come from with my quote unquote work. And as I said, it's not work, but it's a labor.
Well, thank you very much. I'm going to start with a question that I'm going to have all of you actually respond to this one. But let's start with you, Wendy. And that's this. What do you see as the origin of the current systemic racism issues in healthcare? I would say we might talk about them being current, but they probably have always been there. And why do they continue to persist? And how are they harming communities of color today? Let's start with that, Wendy.
Thank you. That's a really foundational question. And I think really it's rooted in understanding that colonization is a seminal process leading to our racialized society in this country and across the globe. But I'm going to kind of focus at least my remarks and kind of my perspective within the context of the US. And that we have to recognize that this racialized context is a setting that we all operate within as individuals, as community members, as institutions, as researchers. I'm a researcher like Barry at heart. But we also have to imagine or examine how Western Europeans began to consolidate resources and create ideologies to support that effort, specifically colonization and capitalism as means of acquiring land and resources. And these groups wielded genocide, enslavement, and assimilation to sustain and perpetuate these ideologies. And I really kind of going back to the researcher part, because this is also a really key part of the story, is that the concept of race was created, of course, to visibly identify agents and targets in order to perpetuate those ideologies. But research played a really key role in establishing the concept of race and actually providing like quote unquote scientific evidence to support those conceptualizations of race and therefore racism. And so I just really think it's important for us to be aware and acknowledge that history. And that really translates with respect to the medical system and the healthcare and public health system in terms of we haven't truly addressed, we haven't provided redress. We haven't reconciled or repaired that history. And that is the reason why we continue to see such tremendous mistrust amongst communities of color with respect to the healthcare system in particular. But quite frankly, you know, this pervades other systems within our country as well.
Barry, I'd like you to weigh in on that question. Big question.
Thank you. And well stated, Ms. Wendy. I'd like to just kind of expand on that and kind of stem off of what she mentioned about the distrust. I think that over the time in history, we have, as people of color, don't have much faith and trust within the healthcare system, which then leads to the doors opening up of all these, we'll say, rumors and other extenuating circumstances that leads to us being separated. I mean, there's areas within the United States where there's people blocks away from clinics and hospital facilities, and yet they still don't go. Why? Because they don't trust the medical field because of the research that was proven, or I shouldn't say proven, but was presented stating that there was a large amount of distrust and that the healthcare field back then in the days, you couldn't trust them. And then to also expand off of that, it's also the communication aspects. I think a lot of the disparities will stem off of a lot of individuals not having the knowledge base or the will to obtain that knowledge. Because right now we're going through a whole stage with this pandemic, and this is just my perspective, that a lot of the information that's going out is kind of being confused, it's being misleading. And because of that, and also the distrust in the healthcare system, you'll see a lot of people of color are avoiding heading down that pathway because they don't want to be guinea pigs anymore. They don't want to be singled out. They don't want to be isolated for these small little projects that in the past have led to basically vast devastation within the people of color in that range. And then falling on top of that, if we educate and then start promoting family again, we can kind of knock off some of these rumors and these misunderstandings about the healthcare and build people back up and get people into those systems. So from my standpoint, I think starting with the family, knocking down some of the distrust and myths about the healthcare fields, I think we'll start moving forward at that level. Thank you.
Mariel.
you. I mean, this is, I think we could do a whole hour and a half on this question alone. So to start it off, it's a great way to start a conversation. I think, I'd like to echo what both Wendy and Barry shared right now. But even thinking about that, it's not history, right? These are, many of our communities are still suffering the effects of racism currently, right? So it's not just what happened in the past with the Tuskegee study or with forced sterilization of women in Puerto Rico. It's the continued treatment of our people coming to the hospital and their pain being discounted, or being told that, that what they are experiencing is essentially all in their head. And so it's very difficult when you're trying to, let's say during a pandemic, to try to, vaccinate people or get people tested, right? It's very hard. You're starting at such a far back point because there's an inherent trust, not just in the health system, but also within those of us, speaking as someone who's within a government agency, of gaining the trust because of that history of current practices and of the fact that oftentimes we don't do the relationship building, we don't do the trust building until something hits the fan, right? We wait until there's a pandemic to reach out to community. And when that is the way of practicing, then it's very hard to gain trust from people. And I have to say, I know that my colleagues here in this area, both within public health as well as in the community, have done so much bridge building, have done so much in order to build trust within the different supports that we've been trying to do. But if we had had those before the pandemic, it would have made things so much easier, and it would have hopefully mitigated the effects of misinformation, right? It would have created that inoculation, so to speak, against misinformation. And so I think we have to think really of not just the past, but we have to think about our current in order to improve our future.
I find it interesting that all of you have mentioned mistrust and misinformation, which to me seems to be one of the, both those things represent the big challenges of our society today. And also it seemed to be at the center of our divisions. But in public health and in healthcare altogether, it seems that those two issues, those two things can be deadly. And so what is the challenge that you face to overcome that? And how do you go about dealing with it? Mariel, let me start with you.
I think first of all is coming to a reckoning, right? Of where has your system failed? So, and I'll just use myself as an example. I come from an academic corporation, again, institutions that are steeped, its foundations are in white supremacy, who have had practices that have been not just detrimental, but deadly to many communities of color and marginalized people. And so, having a reckoning within your system, having a reckoning as an individual practitioner of what you need to do different. I could speak to, our experience in public health in that over the last 2 years in understanding the inequities faced by our communities, even pre-COVID, we had to really think about how are we going to do things differently. An incident command structure, which is a structure that goes into effect when you're doing a crisis response, again, is steeped in white supremacy. So the way that you function, the way that you communicate, again, is not something that is reflective of how communities practice or need to be interacting with us on. And so we looked at what can we do in order to change the way that we were interacting with the public. So looking at, okay, so we know that community, they don't trust us as public health. They don't trust us as government. Who do they trust? And so, building relationship, luckily, a few of us, number of colleagues in different program areas had a relationship already with a number of different community groups as well as grassroots leaders. So we think about how can we build upon the work that was done pre-COVID. So we have initiatives like Best Starts for Kids in communities of opportunity, and other program areas, and both even personal work that we do outside of our quote unquote 9-to-5 job, right? And how can we build on that? And so we created a branch called Community Mitigation and Recovery, where we have priority population work groups, we have community navigators, we have a pandemic advisory and racism community group, or CARCAD for short. We have an equity response team, which is, and I could, I want to speak a little bit about our ERT, because that is a body of work and a partnership that I've worked very closely over with the last 2 years, where we have community members alongside both county and city staff working to think on equity considerations of our response. That is our sole job, quote unquote. And that is a luxury that if you're trying to set up clinics, you don't have the ability to focus. And so working on providing guidance, but also what does it mean to operationalize equity throughout the response, right? So it's not just us doing the equity work and someone can check a box, but it's everyone needing to do their due diligence, but we're there as thought partners and strategic thought partners, right? And so, which has helped to influence things such as our mask mandate that we had in 2020, working together with PARCAG and other groups and providing guidance around the recent vaccine verification mandate. So really looking at, if we're providing services directly, how can we do that with community, but then also thinking about the policies and strategies that have this greater and potential disproportionate impact on our communities. How are we going to do things differently? How are we going to implement things differently? What are the thoughts and conversations we need to have?
Let me jump to Wendy and have you weigh in on this issue. And also, how do we overcome the miscommunication and mistrust and misinformation?
I just want to kind of amplify something that Mariel said, and because this is something that immediately jumped into my mind in response to your question, Enrique, and that was, it needs to be less about mistrust and misinformation, because that almost connotes a level of blame on communities who are being most impacted by racism, and really have this accountability of us as institutions in terms of what are we going to do differently in terms of shifting our policies and practices so that they are no longer having racist impact. What is the meaningful change that we are going to commit to do, and how are we going to work with communities to ensure that what we are setting forth in terms of that change, that transformation, that is grounded in the needs and the priorities of the community? How are we meaningfully bringing community into our decision-making tables? Because I think at the end of the day, that's really what this is about. This is about power. And, Mariel, you had mentioned about white supremacy and how our institutions are just inculcated and steeped in white supremacy culture norms. And, that really comes from this place of this, consolidation of knowledge and lack of inclusion in terms of what constitutes knowledge and who gets to participate in that knowledge generating process. We really have to expand our paradigms, which are extremely oppressive. The way that we behave. I think in the chat, I think I saw someone who was asking, how are we going to move beyond, working with community leaders to demonstrating that we are trustworthy? And I think this, at the heart of this question is, how are we changing our own behaviors, both personally or interpersonally as members of institutions, but also the behaviors of our institutions themselves, because that's, especially if those changes in those behaviors are in response to and at the service of and benefit of communities who have historically experienced marginalization and continue to experience that marginalization, that's where the work needs to be done.
Barry.
Yes, great. Mariel and Miss Wendy, those are great. I'm gonna extend a little bit on it. I'm gonna start with Miss Mariel when she said something about checking the box. I think that a lot of the institutions and a lot of the groups out there that's trying to move this are just going through a process of just checking the box. And I don't think that that's going to get us anywhere. Yes, it may on the surface show that this institution is making an effort to go X, Y, and Z. But if you have to go through the process of doing check this, check that, and I'm doing this, doing that, you're not really doing any of the frontline work to get the needle to actually move. So on that note, some of the things that we're doing here at Seattle Central in my healthcare programs is we're actually doing that groundwork. We're going out recruiting individuals of color to come through our programs. We're pumping them up. We're making the connections so that after they get that education, they can go out and get jobs. This is by far going to be a way that we are trying to make that point to build trust back up in the healthcare system. Because if we can get individuals of color through the system up to higher ranks, I think that'll be the starting point to actually get people to start paying attention, because people of color will start moving that needle. Now, not to say that there's not going to be some people of color that's going to want to check the box, because I hate to say it, it's easy to set goals and just check the box rather than to actually put stuff in place, policies, procedures, and implement something that's actually going to cause change. Because I'll have to admit, change is hard for some. Change will never come for some, but we can at least push the policies in place so that we can move that needle in that direction. Another thing I wanted to highlight in all of this is, again, I was one of those individuals that when I was doing my stuff, and I still do it, I get out in the community. We need some of these leadership individuals that are actually trying to say that they're promoting this process, equity, diversity, trying to get rid of racism in the community, but we never see them in the community. How are we going to build trust in a leadership that's not seen out doing the work that they're actually saying that they're promoting? That's one way that we can actually reverse some of this and get things moving. So I think I'll trim it up there before I get myself in too much trouble talking about some of my personal goals.
I'll let you get into trouble a little bit later, okay? One thing I want to ask all of you is that, we've, during this time of COVID, much reporting has been released about and focused on the fact that, the racial disparities, health disparities in our systems. But in some respects, I think people look at this as being kind of this big revelation. But the fact is that these are all things that have been there for years. And the fact is we never addressed them. But now in a pandemic, they're finally getting some attention. That's all good and well. But how do we get beyond that? Because we could have another outbreak of something else and suddenly realize that nothing has changed at all. But how do we make some movement? Wendy, let me start with you.
I'm still kind of coming back to this idea of the reason, we've talked about legacies of colonialism and racism and how they are really morphed over time to be manifesting in different ways, but they're still there. And that's the reason why we continue to experience disparities. That's why we continue to see this inequity, is because those mechanisms have not been disrupted. And I think maybe kind of coming and peeling back, what is it that is common in terms of these mechanisms which have shifted and over time and continue to perpetuate, is really this idea of power asymmetries, and whether we're talking about interpersonal in terms of how we are partnering. I think I see in the chat, I think Christina was saying, in terms of how are we actually going to co-create and share this framework of knowledge generation so that it's not being held by institutions, that it's being held by community, and institutions are coming along and supporting that? What does that look like in terms of sharing resources? Because you're right, at the end of the day, everything, because again, capitalism is what is driving, our society. We have to acknowledge that and be real about that. And what does that mean in terms of how we make priorities? What does that mean in terms of how we are going to budget for our values? Because I think that's another behavior in terms of how we can begin to start to rectify some of these imbalances. I'm going to pause there because I don't want to kind of veer off, but
that's all right. Well, I'll bring you back in a little bit here. Barry, I want you to pick up on that too.
Okay. All right. Well, one of the things that I think in order to kind of reverse some of this, or at least move the needle, is the major fact that we got into this system or this situation because we didn't have people that represented a certain group of people at the table when all these policies and procedures were being made. I think even currently now, We have people that are still trying to push policies and procedures to move the needle, but we still don't have the right people at the table. I think we need to go out, get some of the community members, pull them to the table. And for instance, when I was in research, we would go out into the community, interact with those individuals that we were trying to research and solve problems for. We had them at the table so that we had our procedures and policies and everything in the similarity so that they understood what was going on. They could spread the word that way. And then also give us feedback on how we could change our policies to meet the needs of the population that we were trying to recruit. So I think with this piece here, if we're going to knock out racism, if we're going to change some of these policies, bring the right people to the table. And again, I know that we may have some people of color that are at the table, but are they there for self-interest? Are they there for the interest of all? That's going to be a major player for that piece. And until we get those type of things going on, it's going to be hard for us to move. And then lastly, before I get too far off, is we need to eliminate some of those distractions. And what I mean by that is, yes, there's certain things in place. We know that there's a lot of talks, a lot of policies, a lot of workshops that want whites to understand that, hey, you've played a role in this aspect of life for people of color. Yes, I'm sure that lots of white individuals understand that. They recognize that. They've gone inward and looked at how they have had effects on people of color. Let's move to that next level so that we have conversations on how are we going to better society now moving forward. If we keep constantly focusing on, look, you need to recognize rather than what we need to do, we're not going to go anywhere. And I'll pause there.
All right. Mariel.
You're asking us some really great questions, Enrique, and I've only had one cup of coffee today, so I hope, I hope I'm up to the task. These are conversations. And questions that I've been in with different groups in different spaces, and I think to add to what both Wendy and Barry were mentioning, I think part of the issue is, for many of us in different communities, we knew there were problems before the pandemic. The pandemic just highlighted for folks who didn't know or were not wanting to know. And what hasn't happened yet is truly a reckoning with regards to what our systems have done, not just within the health system, but in many of the different systems, whether we're talking about education, whether we're talking about the prison industrial complex, whether we're even talking about, and folks have used, the statement as well as the nonprofit industrial complex, right? What has been in place in order to create environments and policies that are harmful to the health and well-being of our communities. And I think that, first of all, when you have that reckoning, then you start thinking about what does restorative practice look like? What is the restorative justice practices that need to be put in place? Basically, what does reparations mean? And there are a lot of folks that oftentimes get concerned when they hear the word reparations. But if you're going to truly want to make change, right? If you want to create an anti-racist system, then you have to have these really hard conversations. And there's a lot of work that needs to be done by the individual before you enter into the communal space, not just for conversation, but for the work that needs to be done. One of the things that I'm proud of that as a county, even with the pandemic, we had a racism as a public health crisis declaration, where the values outline that we need to be anti-racist, we need to focus where the negative impacts have been most harmful, we need to center on Black, Native, and Brown experiences and voices, we need to be responsive, adaptive, transparent, and accountable, as well as focusing on addressing the causes. And those values need to be the foundation that guides our work, but they can't just be words on a page, right? So I could speak as a county employee, as a representative of the county, that I look at these values not as just words on a page, but basically the call to action that I need to have in place in order to do what I can. And I think that's really, again, as a community, as a system, we need to be able to have those values to guide our words, but make sure that they're not just words on a page.
Let's dig into this a bit more. I think we've kind of laid out the fact that the racism in public health and in the healthcare system, it's there. I mean, we know that. But let's talk about how you go about trying to make a difference and change that or dismantle. When you talk about your work at the U and I suppose what you might call anti-racism strategies and how you're trying to, make a difference there.
Thank you so much for that invitation. It's tremendous work, and I kind of want to go back to what was said earlier in terms of the need to really understand and value the time that it takes to build relationships in order for this work to be sustained, in order for this work to be effective. So, coming back to your question, Enrique, in terms of what are we doing as part of the center, we are focusing right now on reaching out to communities of color, partnering with them, identifying synergies, finding ways in which the University of Washington, as a large institution, what we can do as a center to bring our assets, our strengths, to amplify and support the priorities of communities of color in terms of promoting health. So those conversations, I just stepped into this role, it's been less than 100 days. So I'm building those relationships. I am taking the time to, reach out and identify those synergies. But some ideas that I have in terms of potential change strategies, because I really feel very strongly that it's the onus of these large systems of power that need to be doing the work. We need to be doing the change, and we need to not be doing it at the expense of communities of color. So, what does that mean? I mean, it really means taking a step back and being humble and saying, you know what, I have all of these kind of disciplinary paradigms. They have really shaped the cognitive frames that I bring to the table, my lenses, if you will, and to be understanding that I don't have the answers by myself. I need to be able to kind of bring as many people to the table in meaningfully inviting those individuals and those communities and those organizations to actually make meaningful decisions into what we as an institution are doing. I mean, I think it's very easy for us as institutions to do the lip service, to say, we need to do this and we need to do that and we need to do this. But what are we actually doing to demonstrate that we are truly going to be accountable? And so I'm reaching out to communities. I'm working with communities to be able to, I'm a part of PARCAG, you had mentioned, Mariel. I'm very interested in working with that group to work with the larger institutions in that group to say, okay, this is our job, community-based organizations of color, what are your priorities in terms of how we should make shifts? Okay, now we're going to figure out what that means for us, and we're going to work with communities to say, what does this look like to you? How is this landing with you? Is this actually making a meaningful difference in terms of your experience in our particular system, or with respect to engaging with the services that we are providing? How is that looking like this is representing something that you think needs to be done? I mean, this is going to be a long process, and we've just started talking about it. It's something that we really haven't done in terms of large organizational transformation that is community driven. I mean, we've talked about it, but I've been scouring the landscape, and I haven't really seen evidence of large institutions undertaking this level of engagement with communities to make meaningful changes internally. I think we're doing it now. I think there's a lot of synergies across in terms of Public Health Seattle King County. I've been working now more recently with the Department of Health. I know there's a lot of will. I know that there's a lot of commitment. There's a lot of great intentions that we have as institutions. And I think we need to leverage that. But then we also need to be very mindful of what our actual impact is. Because again, kind of going back to white supremacy culture norms and kind of what we've been trained to do, it really is at odds with what true partnership is. And so we constantly need to kind of build in actual kind of, I don't know if it's a stopgap or if it's some sort of kind of checks and balances in terms of making sure that we don't slip back into that mode of operation that's harmful, and to be in continual dialogue with communities about what those checks and balances look like. So I think, as the Arch Center, that's what we're beginning to do.
Yeah.
I'm very, very interested in terms of how we are going to diversify our faculty. We've been doing a pretty decent job with respect to providing access to students of color and other students who have been underrepresented in terms of our undergraduates. That pipeline leading into graduate students and then to faculty, it gets smaller and smaller, and we need to take focused attention to that. But as a center, we need to kind of be able to work in partnership with the people who are doing the work to actually evaluate how well those strategies are working, not just in terms of effectiveness, but also in terms of how people feel they are valued in that partnership. That is just as important as what the outcome is. And I think that's really easy for us to kind of get stuck on as large institutions who've been kind of trained to produce, is that it's not all about producing a thing. I mean, it's also about producing relationship. It's about producing collaboration. It's about producing this idea of collectivism.
Yeah. Barry, let me turn to you in the fact with students. What are you doing and where's the strategy there to make a difference? Because it's what you're passing on to them to hopefully influence them down the road that would hopefully make a difference and then turn into action.
Yes, well, thank you for that question. I'm gonna start first from basically looking at the overall Seattle Central's point of view, and then I'll jump into some of the stuff that we're specifically doing in the healthcare programs. So looking at overall Seattle Central, we started the process of implementing, we'll call it equity, diversity, and inclusion type language in all the courses throughout the whole college. And what that means is every class has some type of connection to an equity, diversity, or inclusion type, we'll say reference or outcome within those classwork, so that our coursework, so that we basically are training the students to be aware of this need to have more of an equitable and diverse lens when they're going in through their coursework, and also once they exit. So that's going on right now. But if you look at more closely into the healthcare fields and those programs, we are actually forming I'll call them affiliations or kind of collaborations with some of the large hospitals around, such as Kaiser, Providence, Swedish, et cetera, et cetera. And what we've done there is we formed a situation where we get either funding or some type of support from those organizations so that we can actually fund and assist students of color to go through our programs, with the end product of them having a rotation at those sites. And under some of the agreements that we have, only 50% of the students can go to that one individual or that entity that's providing that funding, so that we don't flood the market in just one area, that we're able to spread that wealth around throughout the communities. So by having that partnership, by having that conversation with these large industry partners, we're trying to move that needle so that they're more aware of the equity and diversity issues that's within their organization. And by them assisting us, we're able to educate the students, give them those educational opportunities so that they get into the workforce and that they can represent or actually migrate up through that system and be a representative within that organization to help us move the needle, because they've been trained on the EDI, equity, racist issues throughout their whole educational process. And then with us partnering with those industry partners, they're able to continue that education process and also spread the knowledge that they learned with us there. I constantly go out into the communities to make those connections, to build more and more affiliation agreements with different areas, even some of the small private entities, even companies that, are just neighborhood related, so that, again, that we can get that conversation going, so we can build up that trust within the industry so that they can actually and hopefully go out into the communities and spread that knowledge as well. And then as far as, I like Miss Wendy when she brought up the fact that, we also need to go beyond just looking at the students area. I mean, if you look at the administration, you look at the faculty, you look at the staff across any institution, If that's not representative of the community in which that institution resides, then you may have some issues. Because again, people are going to be looking at all of that beyond the students, because the students are going through the system. They look up at the faculty. If they can't see some type of representation throughout the upper portions of the administration and the faculty and staff all in, it's going to give us kind of that misnomer that, yes, we're focused all on students, but we don't care about the rest of the employees at the institution, which we don't want that. We want everybody to feel welcome. We want everybody to kind of feel that they have a reason or a purpose within the organization to actually help them. Because in the educational system, it's everybody from the time a student walks in curious about an institution and the programs all the way up through graduation. And in that process, it's more than just the faculty that they interact with. They have to interact with the registration, the admissions office, financial aid. Then they also sometimes will bump into some of the administration. And if the administration and everyone involved in that student's life through this educational process doesn't give them a purpose or make them feel wanted, we might end up losing that student along the way and never know which part of the process or pathway we lost them to. So I urge the institutions, educational institutions, to look at it from that standpoint, that from the time a student looks just to come in, just to observe, and out of that curiosity, treat them the way they should be treated, and then walk them through the whole process. And I'm not saying teach them, or what one of my instructors said calls learned helplessness. No, that's not what I'm saying. What I'm saying is basically give them the tools and the processes in place so that they can learn and develop and process themselves and then reach that next level. Because if we don't challenge students, we've lost the whole battle. And if you compare this movement that we have now, I'm getting ready to go off on a little tangent, sorry. If we compare this movement to what we had back in the 60s, in the 60s, they had the notion and the motion of saying, we can do X, Y, and Z. Nowadays, it seems that we have flipped the script, and now we're in an undercover method are saying we can't do it. Because in some of the conversations I've had, they said, well, you can't hold people of color to be in on time. You can't do this, you can't do that. And people of color, to some degree, have accepted that. And the students have accepted that. So now they expect extensions, they expect this, they expect that, instead of us pushing and promoting, you can do this, you can be better, you can learn, you can do whatever. Put the can on there instead of you can't, and give them an excuse to say, hey, well, you gotta do this for me because I'm a person of color. Let's knock that out, and let's start making people, holding them responsible and build them up to that level. So in the educational process, that's what I would say.
Mariel, one of the challenges, I suppose, not only the work that you do is reaching out in the community, but what about within the county? You know, there's been the effort, as you mentioned, you know, the county finally, I think during the time of the COVID really hit, when they came forward saying that, you know, racism is a public health issue. But how do you reach people in the county to also, you know, have strategies for them to understand that equity, diversity, and inclusion is I mean, it's important. It's so much so that that you've got to take this seriously, because, you know, you can get stuck in what was the past.
I'm sorry, my dogs are very excited about this equity conversation.
I really upset the dog with that question, didn't I?
well, he wants to participate. And
well, I think Barry wound him up, so, you know.
I mean, that's a great question, but I think very similar as in academic spaces. I mean, for us in the county, a lot of it is looking at who are we recruiting, right? It's one thing to hire staff of color, but what's the retention rates? How are you supporting them? What are the microaggressions that they may be experiencing within that space, right? And so for us as the county, I know for us as a department, that's one area that we're looking at very closely, in that it is one thing to hire, but it's another thing about how can you maintain that staff of color. And very similar to how both Wendy and Barry expressed, I mean, the higher, quote unquote, the higher up you go in management, the wider it becomes, right? And so why are we not doing a good job in hiring and retaining managers and other leadership of color? And so, part of that is, for us is looking at, and again, my dogs are very passionate about equity.
Yeah, I can tell. Hey, what I'm going to do, Mariel, is that I'm going to let me jump to Wendy, and then you can give your dog a sedative. Anyway, and then we'll come right back to you. Okay. Okay, go ahead.
I just really would like to pick up on this idea of recognizing that, when we're talking about diversity, equity, inclusion, I think it's also really important to center anti-racism specifically, because that is very different in my mind than just, diversity, equity, inclusion, because it has a specific focus on recognizing that we are operating within a racialized context. So therefore, the expectations and the environment and the ability to succeed is not equitable. And so there needs to be specific kind of strategies, if you will, change strategies in terms of, changing the culture so that we are being very intentional and very mindful about what we are doing to essentially reset that bar so that we are promoting equity in terms of what those expectations are. So for a specific example, in terms of, something that I'm proposing to do within the University of Washington, along with 8 colleagues of mine who are underrepresented racial and ethnic faculty, as well as faculty of color, is to provide very targeted specific support for faculty of color, for students of color, to be able to kind of essentially, I'm just going to say, get the tea. How do you navigate this racist system? What do you need to be mindful of? What do you need to know in order to be successful? That's one part of it. When working with faculty who are white, okay, here's the tea for you. Here's how you can rectify these power asymmetries in your relationships with faculty and students. Here's kind of what your role is in terms of changing our policies and practices within the institution. And then within the institution itself, okay, what are we doing? Because, a lot of times we like to think we have these equitable practices and policies, but it's the implementation where things become disproportionate. And so that's why I'm saying there's like this combination of attending to our norms and kind of how we execute our policies and practices, as well as looking at our policies and practices. And so for another kind of more concrete example with respect to partnerships that I have with DOH and health systems that are contracting with DOH, is really working with clinics specifically to understand, why is it really important that you're collecting data on race and ethnicity amongst your patients? Why is it really important that that information is coming from the patient, that you're not deciding who somebody is, but that that person is able to identify what community that they are belonging to? Now, how are you going to use that information? How you're going to use that information is you're going to take an assessment of like your delivery of clinical services, your outcomes, and you're going to see how are those outcomes falling out amongst these different groups of your patients. Is it equitable? If it's not equitable, then what needs to change in terms of what you are doing as a clinic, what you are doing as a provider, what you are doing as front desk staff, to be able to make it so that those outcomes are equal. And that will necessitate conversations with your stakeholders, with your community members, with your patients, in order to understand, first of all, what is the experience? Like, what is happening that is causing this difference? And then what are possible solutions that you can co-create together, and then implement and evaluate and test and see, is this working? Is this changing the experience? Is this promoting equity? I mean, I think that's really, for me, I'm kind of looking back at the chat and the question that Monica was asking in terms of what are concrete things that we can take away. And I think one of them, and it might seem really simple, but is really having this equity orientation and finding how you can apply that, no matter what part of the organization you're in, no matter what you are doing. I mean, it could be in terms of how you are functioning as a team. You know, I'm learning from my community partner. We're co-teaching a class together here at the UW, just an amazing experience. And she's like, you know what, let's flip the script in terms of the students. They need to learn how to do this. You all need to manage your time and ensure that everybody at the table, i.e. everybody in this Zoom room, because we're teaching on Zoom, has the opportunity and an equitable airtime, you know, the ability to be able to contribute. How are you going to facilitate that? You know, that's what I think is key. I mean, and it can happen on so many levels, in so many venues, in so many different ways, but very much needing to be intentional about that all the time. Because otherwise, if we just kind of do, that doesn't happen. We have to be very mindful.
Mariel, I'm going to come back to you. Go ahead.
Thank you. And Wendy, you just said it spectacularly. You know, I think what I also want to be able to bring out is the interrelationships between different institutions. So for us in public health, for example, when we're hiring, we are in part dependent on who is going to the School of Public Health. And how are they being taught? What is the practice within that academic institution? Who are they recruiting as students, but also what does their faculty and leadership look like? Because then that is going to inform, I guess, the field of persons that would then be interested in applying to our department, right? And so there's this interrelatedness that we can't separate from. At the same time, that question of support is so critical. You know, when you think of when you think of professionals of color, and I'll just use public health because that's my experience and that's my background, that when you're not well supported and you're trying to navigate those waters where you might be facing microaggressions, when the way that you relate to others, sometimes even the way that you present, right, your hair, your clothing is quote unquote not the norm. And those are very difficult waters to navigate. And so as institutions, really, what are the supports that you are creating? So like within the county, we have different affinity groups, both at the county-wide level. But then we also have, you know, equity groups within our different divisions within the department. And part of that is, you know, finding your people, so to speak, in order to have those supports. But then also as an institution, what are you doing to really hold yourself accountable if, as the values I listed for the Racism as a Public Health Crisis Declaration, if we are true to those values, what are we doing as an institution in order to make sure that we're centering on BIPOC staff and other marginalized voices? How are we going to mitigate the negative impacts of our system on not just our staff, but also on the community that we work with and that we're serving? So thinking about also how, I mean, the question that Wendy brought out about co-creating, how are we co-creating with community in an authentic fashion that brings in their experience and their expertise, and we hold it at the same level as we perhaps as an institution hold the value of consultants with a bunch of letters after their name. And so it's just, but you can't do that. You can't make those changes and those practices if you're not having, and I want to use your term, Wendy, I love it, if you're not having or giving the tea, right, in conversation, because that's so important. Without that discussion, then you're not going to be able to have change.
We have about, let me see, about 5 minutes here before we're going to go and go into our kind of breakout groups and things like that. I'm curious, you know, we've talked a lot about kind of the what strategies to take, you know, the issues that are there, the fact that there's so much evidence from the past that yet we know today things haven't changed a lot. But we also notice, and Wendy, you talked about this, I think all of you, but you touched on it, that sometimes you have an institution that where the leadership is leading badly and the racism is there. And I point to Dr. Ben Danielson speaking out at Seattle Children's after, you know, leading Odessa Brown Clinic for so long. I guess when you look at that particular case, particularly, you know, this was a very respected guy that stepped up to challenge, this big institution. Without that, and there's still some question as to whether enough has been done there. But those are the things I think that people look at sometimes and they think, I'm glad he spoke out. Well, I don't know that we're really getting the change that we need. Do you feel that way sometimes? And that's why when do you talk about those issues of not just looking at with the students, and Barry, you mentioned that too, that we don't put the people at the top on enough of a hot seat to realize that, they're part of what needs to change and they need to step up and accept that as well. That's kind of a, diffuse broad thing there, but I'd like you guys to weigh in on that. Wendy?
That is a great question. This is something that I was actually just discussing with a colleague of mine just the other day in terms of why is it that I'm choosing to stay here at the University of Washington? I mean, we're a large institution. We have inflicted harm. We're continuing to inflict harm. And the reason why I'm staying is because there is the ability for us to be accountable in terms of the commitment from faculty, the commitment from leadership. We're not doing it perfectly, but we are at least willing to go there. I think there's kind of multiple components, kind of going back to something that you said, Barry, in terms of the importance of having leaders of color. And I think, it's no accident, in terms of what our leadership looks like here at the University of Washington. I think it's very, I think we've been able to move in a direction that we probably wouldn't have been able to move under the leadership of someone other than President Kause. And so, I stay here because there's the ability for me as a faculty person of color, and yes, I have tremendous privilege. I like to very much own that I have proximity to whiteness as a biracial Black woman, but I also am a woman of color. And I have this ability, at least within this institution, to feel like I can lead up. I can partner with our leaders to be able to have equity in mind. I can lead in all directions. And I really think that all of us here within the institution, and I would, call out for everyone within other institutions to have a similar kind of culture and vision in terms of being able to lead, and that anybody can be a leader, that it's not just the CEO or just the director or just the president, that we all can be leaders. Although I will absolutely agree that it is critical to have those public facing leadership positions, the leaders who essentially are making the final decisions, to have more representation amongst those leaders. Absolutely critical. I know in a conversation the other day, my deans, my dean in the School of Nursing is a woman of color. My dean here in the School of Public Health has said, my job is to make sure that the person who comes and replaces me does not look like me. I mean, there's that level of commitment in terms of we need to shake things up. We need to do things differently. And that's the reason why I continue to stay here, because I feel like there's opportunity. And I'm really excited to be a part of that.
So Barry and Mariel, I'm going to have you, don't mind, give me fairly brief answers so we can move on to our groups. Barry.
Okay, thank you. This is a very loaded question. And the reason I say that is...
Yeah, it is, isn't it?
It is, because especially in the higher ed systems, I don't know how it works in some of the public systems or the private institutions, but as Miss Wendy was mentioning, you have to have that higher up representation and support. But like I said before, change is hard. And sometimes the upper administration, they have their mindset on one goal and they want to go down this path. Anybody that challenges that, a couple of years later, you don't see them around anymore. So, and that doesn't matter what color they are. So if we're going to do this, upper leadership needs to have an open mind and be willing to be criticized for some of the stuff that they're doing. Have that open conversation, because change is not going to be easy. And it's not going to be an easy conversation on any level. And as long as we individuals under that leadership are fearful of our job, we're going to tiptoe through the tulips, so to speak, and push the needle, but we won't be able to get that needle to move as fast as we should if we had a better upper administration that was willing to have conversation, and I mean open conversation. That's going to be difficult. I'll cut it short there because I know we've run out of time, so I'll turn it over to
Mariel, do you want to weigh in?
Yeah, and I think, and thank you, Wendy and Barry, I want to echo a lot of the comments that they shared. I think, for myself personally, I have a number of colleagues that if it weren't for them, I think it would be really difficult, right, to continue with the work. I think the one difference that we may have, because we are a local government agency, is that we are beholden to our constituents, right, to county residents. And so accountability for us comes not just from an internal source, but it comes from an external one as well. And so that's where the relationship with community partners is so important, but it's also important for community residents to hold us accountable. If we've made this declaration of racism is a public health crisis, which it is, and we've laid out our values, and if we're not living up to those values, for those of us that are internally doing the work, we need those external partners as well, right? Because that's how we can also have the accountability.
I just want to say thank you so very much for this opportunity. It's been wonderful to be in community with all of you, to have these conversations. I think the thing that I would like to kind of leave everybody with is that anti-racism really is about action in the face of need, regardless of who or where we are. And that it's about recognizing that intention is really not what we should base our accountability on. We need to be accountable for our impact, both as individuals. This is something that we talked about in our small group, both as individuals, because I think equity work starts with us as individuals, as well as our organizations or larger collectives that we might find ourselves in. That, anti-racism is not about me or you or those experiencing privilege and how we feel. It's about the work. And I think that's something that I really think is important, is really kind of centering those who are most impacted in terms of what I'm doing. And whenever I start to have, feelings about certain things, that to remind myself that that's not what this is about. Yes, I'm human. I have emotions and sometimes act from a place that doesn't align with my values. And I assume that as humans, all of you can also relate to that. And so I need to accept that I do, and I will make mistakes, but I will be accountable for those mistakes. I will learn from them, and I will keep moving forward in partnership to promote equity. And I think that's really what it kind of boils down to at the end of the day. So thank you so much.
Thank you, Wendy. Barry, how about you? Final thoughts.
Oh, there we go. I'm on mute. Sorry about that. Miss Wendy wrapped it all up. I mean, I don't know what's left after that, but I would just add to it that, yes, please reach out to your community leaders and individuals to kind of help us uplift the community, spread the word, get the knowledge out there, build up that trust and connection between all levels of life so that we can actually better the future. And by training the younger generations along with the current generations, I think our future will be a lot better if we do keep those connections. So thank you all for having me here, and thank you all for listening.
Thank you so much, Barry. Mariel, your final thoughts.
Thank you so much. And I mean, Wendy, Barry, you guys leave me up to pinch hit with not much to hit on. But I think one thought I'd like to leave everybody, and I'm really appreciative of the time and the conversation we've had this afternoon. But I think what I'd like for us to focus in on is the language and words as we use in our discussions and how we think about anti-racism work. As Wendy mentioned, impact is much more important than intent. For those of you who work closely with me, my favorite saying is that the pathway to hell is paved with good intention. Because again, you can have the best of intentions and the impact's going to be traumatic and negative for our communities. And that's why language is so important. Maybe it's because I was a liberal arts major as an undergrad. And that's why I just totally geek out on that. But I think if we are intentional on how we use words, we have to be brave in describing things as they are, So don't skirt around terms such as genocide and white supremacy and trauma. But at the same time, really thinking about how do we build together, right? There's some individual work that needs to happen, as Wendy mentioned, but we need to build together in order to create anti-racist systems. And so I think I'd like to leave more with a question and thought for the group. And just thank you again for the opportunity.
Thank you, Mariel. Enrique, any final thoughts from you?
Just would like to say thank you for letting me be a part of this today. I appreciate it very much. But also, I think we have a lot of work to do, and I wish things would change overnight. I'm glad to see that there's been a racial reckoning. I think when it comes to public health, that I'm glad to see that King County stepped up and said that racism is a public health issue. I think the country needs to embrace that as well. And I think that, all of us need to be very aware of the efforts to divide us and try to not let that sidetrack us. And especially in healthcare, because it's our lives that are at stake. I'll leave it there.
Well, thank you so much, Enrique. And thank you to all of our panelists. And thank you to everyone who participated today. It was a great conversation. I really appreciate it. Oh, I also have to thank our sponsor, Alaska Airlines, for promoting the Civic Bootcamp. So really appreciate that. So please, everyone, take care and stay safe and have a great day.